Imagine you go to the doctor, you're sick, and you trust the people that are treating you. Instead of fully helping you, they're secretly studying you. They don't tell you everything. They don't give you the full treatment that could save your life. They just observe what happens. That's not a hypothetical, it's what's happening in the real US medical history. Today, we're looking at the intersection of scientific research and human exploitation. Human research has driven major advances in medicine and public health, but those advances have not always been ethical, and marginalized groups have often been the ones most affected. We'll focus on what makes people vulnerable in research and what informed consent fails and what historical cases reveal about these failures. Because this isn't just the past, these ethical issues shape the rules that we still use today. Vulnerable populations. First, what does that mean when we say vulnerable populations? These can include children, elderly individuals, incarcerated people, and people with disabilities, or people with limited access to education or healthcare. But the deeper issue is power. The vulnerable population is any group where there is an imbalance of power between research and participants. On the other side, you may have individuals who cannot fully understand complex consent forms, who feel financial pressure to participate, or who come from backgrounds where questioning authority is discouraged. This creates a situation where participation may not fully be free or informed. This leads to exploitation, which is the unfair use of people for the research benefit without fully protecting their rights or their well-being. Key risks include complicated consent forms that are hard to understand, financial pressure to participate despite the risks, consent that is legal but not truly informed, and language or cultural barriers that increase confusion. This is why informed consent is so important. It requires clear information, understanding, and voluntary agreement without pressure, but history shows that this system has failed before. Ethics are not always followed. Two major examples of these failures are the case of Henrietta Lacks and Tuskegee syphilis study. In 1951, Henrietta Lacks was treated for cervical cancer at Johns Hopkins Hospital. During her treatment, her cancer cells were taken without her knowledge or consent. These cells, known as HeLa cells, became one of the most important tools in medical research and are still used worldwide today. Even though informed consent was an expected ethical standard at the time, it was not consistently enforced, especially for marginalized patients. Her family was not informed for years and received no compensation for decades. This reflects a clear failure of transparency and respect for patient autonomy. In a similar way, the Tuskegee syphilis study began in 1932, conducted by the U.S. Public Health Service with the Tuskegee Institute. This study involved African American men with syphilis who were deceived and denied treatment so researchers could observe the disease's natural progression. Even after an effective cure became available, treatment was still withheld. This study continued until 1972, when it was exposed and declared unethical due to the lack of consent and harm to participants. In 1997, Bill Clinton formally apologized for survivors and their families. He held a presidential public apology. Both cases show how vulnerable patients were exploited and how informed consent was either ignored or completely absent.
Which brings us to the informed consent, probably the most important concept in research ethics and also one of the most routinely mishandled. The idea behind informed consent is simple. Before anyone participates in a study, they need to actually understand what they're signing up for. So what's the study about? What will they have to do? What could go wrong? And critically, they need to know what they can say no to. They can walk away at any time, no consequences. That sounds straightforward, but here's where it gets complicated. Consent isn't just a signature on a form. It's supposed to be a genuine, two-way conversation. The researcher explains, the participants ask questions, and by the end of it, the person truly understands what they're agreeing to. But in reality, that almost never happens perfectly. Consent forms are often written in college reading level, sometimes higher. They're long, they're full of legal and medical jargon. People sign them because they feel like they're supposed to, not because they genuinely process every paragraph. If someone doesn't understand what they agreed to, did they actually consent? That's not a rhetorical question, it's a real ethical problem. Beyond the forms themselves, there are a few other ways consent breaks down in practice. One big coercion, not always overt but real. A patient who feels uncomfortable saying no to their own doctor, someone in a low-income situation who sees a paid research study as a financial lifeline and doesn't feel like they can afford to worry about the risks. Nobody's holding a gun to their head, but the circumstances are doing a version of that. That's not free choice. Then there's language and culture gap. If your primary language isn't the one the study is conducted in, you might not be fully understanding what the information is being shared with you. And in some cultural contexts, questioning someone in a position of authority, like a doctor or a researcher, just isn't something people feel they can do. So people nod along, and even when they're confused. The consequences of this are real. People get hurt, they feel devastated, and on a larger scale, these failures erode public trust in medical research, which makes it harder to conduct good science in future. Informed consent done badly doesn't just hurt individuals, it damages the whole system.
So far, we've talked about multiple examples: the Henry Lax situation and Tuskegee trials. However, it's going to be a lot more complicated. What happens when you actually get meaningful results, but it came at someone else's detriment? An example being finding drugs to treat malaria. Multiple inmates had to be inoculated with the parasite and then forcibly given drugs that had negative side effects. Though the inmates technically did give their consent, due to the power imbalance of being a prisoner, it can be assumed that this consent was not ethically given. However, doing this gives us malaria drugs that we use to this day. Another example is during World War II. Japanese researchers conducted horrific experiments on Chinese prisoners of war, developing knowledge about frostbite through deliberate exposure and torturing. These experiments were grossly inhumane and should never be done again. However, by doing these experiments, we do understand things about the human body that we cannot understand without having to put people through those conditions. And that's because the commonality between all these examples that we have given you is that it isn't just cruelty. It's a fundamental failure to see people being studied as fully human, as people whose lives and bodies deserve the same protection as anyone else. Which brings us to the ethical guidelines we follow today. After the atrocities of World War II became public, the world started building formal frameworks to make sure nothing like that could happen again. That's where the Nuremberg Code came from, established in 1947 after the Nuremberg trials. It laid out the principle that voluntary consent is not optional, it's non-negotiable. You can't force anyone to do anything they don't want to do. Then, in 1979, the US released the Bummer Report, which outlined 3 principles that still form the backbone of research ethics today: respect for persons, beneficence, basically, do good and don't cause necessary harm, and justice, meaning that burdens and benefits of research should be distributed fairly. Today, institutional review boards, IRBs, are supposed to enforce these principles before any study involving human participants getting off the ground. But here's the thing: guidelines are only as strong as the people following them. They can't account for every gray area. They rely on research to interpret and apply them honestly. And as history has shown us, that doesn't always happen. The framework is necessary, but it's not sufficient on its own. Ethical guidelines form the basis for ethical thought, and it's on the burden of the researchers to think ethically.
So, what does actually doing better look like here? First, it starts with fixing how we handle informed consent, because clearly, just acknowledging past mistakes is not enough. Cases like Tuskegee and Henrietta Lacks show that people were misled, not fully informed, or completely left out of the decision making process. So, informed consent cannot just be a one time signature on a form, it has to be an ongoing conversation. That means using plain language, avoiding technical jargon, and making sure participants actually understand the purpose, risk, and benefit of a study the entire time they're involved. And that process has to work for everyone, not just people who already understand the system. That means providing translations, using interpreters, and being aware of cultural differences in communication. Researchers can even check understanding by asking participants to explain the study in their own words. Because if someone cannot clearly explain what they agreed to, then they really didn't consent. But communication is just only part of it. Oversight matters too. Institutional review boards need to take a closer look at studies involving vulnerable populations and really think about power dynamics, recruitment methods, and the risk of coercion. At the same time, responsibility does not stop there. Researchers themselves need to be trained to recognize these ethical risks and put participation first. Guidelines like the Belmont Report and the Nuremberg Code give us a foundation, but they only work if people actually apply them. At the end of the day, reducing exploitation comes down to clear communication, cultural awareness, and real accountability. So here's the bigger picture. Research has led to major advances in medicine and public health, but that progress has not always been ethical. Cases like Tuskegee and Henrietta Lacks show what happens when informed consent breaks down and when power imbalances go unchecked. There are reminders that the pursuit of knowledge should never come at the cost of human dignity. Moving forward, the focus has to be on doing better, That means strengthening informed consent, improving oversight, and creating a culture where researchers are held accountable for how they treat participants. Because ethical research is not just about results. It is also about how those results are achieved. If people do not trust the research process, then they will not participate, and that affects the future of science itself. At the end of the day, ethical research means prioritizing transparency, fairness, and respect for every participant. That's how we move science forward without repeating the mistakes of the past. Thank you for watching.